Hi everyone, I'm Brigid,
It's Dr. Pat here.
and we thought we might jump on and just talk to everybody about coronavirus, because you've been working all day, Patty, with all your antenatal patients, and there's been coronavirus questions all day, hasn't there?
Yeah, all day, which is good. I mean, people are right to be concerned, and the level of sort of alertness and anxiety about it has really come up in the last few days.
It really has, hasn't it? And it really feels like we're on the brink of the surge, doesn't it? So,
well, I guess we might be,
yeah.
which is why it's a good idea to be talking about exactly what the risk is in pregnancy.
So what do we know about coronavirus? And we're just specifically talking about women who are pregnant.
Yeah, well, we know that some women who are pregnant have caught coronavirus, and there's a group of about 130 women, Chinese women, who were analysed, and it seems that they were about as likely as everybody else to get coronavirus in the first place. And then once they got it, they had a similar pattern of severity to the rest of the community.
So it's not like the flu. So pregnant women are more susceptible to the flu, aren't they?
Yeah, to ordinary seasonal flu.
Yeah.
Are more susceptible due to changes in the immune system during pregnancy, and also more likely, if you get it, for it to be very severe.
All right. So what about if I do get it and I'm pregnant? Do I pass it along to the baby growing in my tummy?
We don't think so. There's no evidence at this stage that it can be passed from mother to baby during pregnancy. So then the question becomes, what do we do if you've got coronavirus at the time of labour and delivery?
Oh, yeah.
And I guess there are two possibilities in that situation. One might be that the woman and her treatment team decide that isolation from the newborn is the right way to go to protect the newborn from getting the virus altogether.
So what do you mean? They separate the mum and the baby?
It could be separated for the rest of the mother's infectious period, which would be incredibly tough, obviously, but maybe the right way to go after discussion. And the second possibility, of course, is that we might accept that the baby's going to stay around mum, probably be infected, but like most infections involving infants and children, they're not very clinically severe.
Yeah. Yeah. What about if the mum's, I suppose, does that also go if the mum's breastfeeding, or what happens in that situation?
Yeah, again, two schools of thought. Some experts are saying that maybe breastfeeding would be best to be ceased to protect the child. And again, there's another school of thought that says that if the baby's in close contact with the mum, it's very likely to be infected anyway. And that infection is unlikely to be severe. So the benefits of ongoing breastfeeding may well outweigh the risk of the coronavirus transmission.
All right, I'm going to really make you decide here. So I'm pregnant. I've just had my baby. I'm breastfeeding, and I get coronavirus. As your wife, do you want me still breastfeeding?
Yes.
Yes. All right. That's good. Well done. It's hard.
No
isn't
idea
it?
you were pregnant.
Yeah.
Well done.
No idea. No, I am not pregnant. That's fine. All right. So what about, say, for example, I've got, I don't know, travel plans or something coming up in the next couple of weeks. What would you advise?
Yeah, that was probably the most common question I got today. In fact, the women themselves were really cool about it. They felt they were well informed. They'd read the government messages and the messages from the health authorities. It was more that they were saying, my husband is freaking out, and he said, you must ask Dr. Pat what to do about coronavirus. So, I think that the most common thing that came up really practically was, what about the travel that we've got coming up? And I think we're at the point now today where travel that's not critical is probably best left aside for the moment, and we probably should all be sticking close to home.
Yeah, and we are practicing what we preach, aren't we? Yeah, we had a big holiday planned, leaving in a couple of weeks to Italy, and we cancelled that a couple of weeks ago. So it's so disappointing, but we also worried about the anxiety levels as we were traveling. Really, is that worth it as well? You've got to ask yourself that question.
Yeah, and exactly even if you decided to go and weren't so worried about yourself, what the experience would be like once you got there, plus the very real possibility of forced isolation when you got back.
Yeah. All right, so what about then if I'm 28 weeks pregnant and I'm working as a nurse or a teacher, or I'm in hospitality, I'm exposed to lots of people, what would you advise?
Yeah, again, we covered this today with lots of people because patients are nurses and school teachers and ambulance officers and so forth. And right now, the bottom line, the advice is to follow the recommendations about hand washing, avoiding unnecessary or unprotected contact with sick people, but otherwise at the moment going to work and going about your normal business.
And knowing whether someone's sick or not is really hard, isn't it? That's probably the bit that makes you feel anxious, because you're just so unsure who's in your environment that might be sick.
That's right. So the ambulance officers have got protective gear in the ambulance, and they can turn up in the full spacesuit if they need to.
Yeah. So Patty, what do I do if I suspect I've got coronavirus?
Sure. So the current advice, of course, is to contact your local health team, and that's the easiest way to do that is through your local general practice, and that by telephone, and they will have systems in place for you to be checked.
Yeah, that's really important. You've got to call first.
Yeah, and I think that's what the same thing I was saying to the patients at the clinic today. If you're sick, don't just turn up. Absolutely, if you need me, I'll see you. But if you call me first, we can set up to see you in a way with some infection control measures in place.
Yeah, we've got some friends who are GPs, and they're saying that they go into the car park to do the swab, and it's just about not exposing everyone, including receptionists and other staff, the people in the clinic, to something that might be potentially coronavirus.
Yeah. And lots of my pregnant women, they need to be seen during the pregnancy, but not right away. So if there's no particular urgency to their pregnancy review, then there's time for them to be checked over, tested, and get the results before they need to see me. So absolutely, I want to know about it, but by phone.
So what are the symptoms? It's a bit grey, isn't it? I've heard so many different symptoms that people have experienced before they got coronavirus, but what are we looking for?
We're looking for, in particular, people with a respiratory illness, so a cough, productive cough, perhaps shortness of breath, but also as part of a broader, what we would call flu-like illness. So what you and I might have previously called the flu, things like a high fever, muscle aches and pains, headache, abdominal pain. And anybody with more than just the symptoms of a mild cold, but more like a flu-like illness at the moment should be getting tested for COVID-19.
Yeah. Wow. I really do feel anxious at this time, like a lot of people. And it's that anxiety that I feel is going to be around for a little while.
Yep.
Do we kind of know how long it's going to go on for?
Yeah, well, the simple answer is we don't. But I think a lot of very reputable sources are talking about a peak not occurring for a couple of months.
In Australia?
Yeah. And then there's a long resolution phase after that. And I think this could well be part of our daily life and daily discussion and daily preparation for 4 to 6 months.
Yeah, right. Wow, I wonder if that makes everyone want to go out and buy more toilet paper.
I hope not.
It's hard. This is how we protect ourselves, and this is how we feel like we're doing something towards protecting ourselves, and that is stockpiling. I
think we should be listening carefully to the developments on a daily basis and taking the advice from the experts.
That's right. I have been looking specifically at federal websites, and I'll put maybe in the comments I'll put which websites I'm looking at for my news. And to be honest, I'm doing it once a day. Once a day, I do a coronavirus update for myself, and that is where I look at how many cases have been recognised in Australia, and I really try not to consume too much more media around it.
Yeah, and I think for the pregnant patients, that's particularly true. We don't want people to be getting miserable about this. I want you to be enjoying your pregnancy and looking forward to a healthy remainder of the pregnancy and a healthy newborn and a healthy you. And I think that being aware of this, as you say, about once a day is a good idea to check for updates. But otherwise, having confidence in your treatment teams that you and the baby will be okay.
And, to be honest, you should have a little bit of a hotline. You're pregnant, so if you've got any issues, then call your treatment team. Yeah. Okay, and on that note, what we're going to do is I'll pop this up and in the comments, if you've got any questions, we're around all weekend. We're not doing anything. We're not going anywhere. So if you've got any more questions around that, then just pop them into the comments or DM us and we'll try to get back to you.
Okay, stay safe, everybody.
Bye now.